Well, for over 2 weeks, residents of Melbourne and the Mitchell Shire have been on stay-at-home orders by the Victorian government, yet cases continue to rise. As we know, doctors today across the country are now pushing for harsher restrictions in Victoria. A stage 4 lockdown is being discussed. They say, if not, will risk up to 700 new COVID patients a week in Victorian hospitals. Dr. Tony Bartone is the president of the Australian Medical Association. He joins me now from Melbourne. Thank you for your time, Dr. Bartone. We were told when we went into lockdown now, just over 2 weeks ago, that we should see a fall in COVID infection numbers after the lockdown had been in place for a 2-week incubation sort of period. We're now at that point. It doesn't appear that the numbers are going down. In fact, they're strengthening, certainly in the high 200-300s. We saw obviously the other day nearly 500. If they don't come down and they stay at this rate, how long will it be before our hospitals really struggle to cope?
Good evening, Peter, and thanks for having me on your show. Look, obviously, this is really the difficult times, very concerning times, and we're watching those numbers. But indeed, we need to watch those numbers even more carefully and looking at the subsets of those numbers. It would seem that in the most recent days, it's been driven particularly in aged care, in other occupational settings, and that the movement and the mixing in the community has started to drop a bit, but clearly there is just for my liking, those numbers still reflect too many cases, too many options where that virus has been transferred from person to person and indeed resulting in infections. That's why we've been talking about putting in, looking for that further circuit breaker, because it seems that the community hasn't really completely as a whole taken to the message. The majority have, but we've still got issues of people flagrantly saying, no, I'm not going to abide by the guidelines. I'm not going to wear the masks that were introduced this week as part of an additional measure of restrictions, something as an interim, as an extra extension on the stage 3, stay-at-home messaging. And really, if we're now looking at the numbers, because there is a lag indicator between the significant rise in cases to the episode of hospitalisation, to the next layer, to ICU, and unfortunately to that ultimate indicator that the number of people who lose their lives to COVID-19. And that clearly is we're starting to see the result of last week and the week before's numbers, where they were clearly exceedingly rising all the time. And indeed, today at 300, at almost 16 days from the imposition of stage 3 stay-at-home restrictions, is still too much for us to be really comfortable at all that we've got this under control. And certainly we wait to see what the significant measures that masks will be put in place, what will effect that will have on the numbers. So we're watching in terms of a number, in terms of when will our hospitals reach that ultimate peak. Look, clearly, we have got enough hospital beds and enough ICU beds and enough ventilators at the moment, and indeed we can actually requisition more. That's not the critical factor. What we do know at the moment, though, is that our hospital staff, in terms of doctors and nurses, to man those beds, to man those ventilators, to take care of the ICU patients, is really at a stretch, at a breaking point, because of the number of healthcare workers that are indeed either infected or furloughed because they're contacts of infected cases. And that's the real risk, that's the real pressure in the system. Welcome the additional reserves that are being brought in today, that were announced today and being brought in. But that's the limiting factor, not the number of beds, not the hospitals, but then clearly our workforce to meet the demand.
Well, I got around Melbourne today. I had to go to the shops as I'm allowed, and I had to obviously come to work. I don't think I saw a person out on the street. There were a lot of people wandering around, walking around, doing their exercise, whatever. They were all wearing a mask. I think the adoption of the mask has been very strong. If you listen to the Premier this week, there was a discrepancy. 9 out of 10 people who felt unwell in the period between feeling unwell and getting a COVID test were out and about. I mean, that's a horrific statistic. But even once they were in the test phase, they had the test but waiting for the results, we still had over 50% still out and about. I think that's obviously a real worry. I'm going to ask you 2 questions here. what would stage 4 look like and what would you want it to look like? But isn't the real issue we have in Victoria at the moment this enormous vulnerability of aged care residents, and are we doing enough there?
Okay, so there's two parts of that question. And so the first one, what would stage 4 look like? There's no rule book, there's no copybook for this, but essentially it would mean that all but essential services would be required to stay at home. So that in terms of further, all businesses and construction would probably have to come to a halt for a short but defined period. And that's one of the key messages from this. I think if we did introduce that, it would send a really strong and powerful message to the community that this is very serious. Let's all do the right thing and we'll get out of this and back to stage 3 and then back to stage 2 and out of this back to some sort of COVID normality. At the moment, there just seems to be not enough understanding that unless we really significantly clamp down on the movement and the mixing in the community, we're not going to get on top of this. Now, in terms of aged care, that is exactly, I've described it as a very seriously concerning situation. Aged care was extremely stressed, under the pump, under duress before COVID-19. What COVID did was basically light the match to the tinderbox that was ready to go. And now we're seeing the results of that in terms of the explosion in aged care residents and staff that have become infected, especially in recent days. This is the real situation. These are very vulnerable people. We know from overseas experience that aged care homes are indeed the front line when it comes to COVID hospitalisations and people losing their battle to COVID. So
just let me just jump in there, Tony Bartone. What do you want to see happen now? What do you want to see done differently in aged care?
So really what we want to see is an increase in the redundancy of the workforce. So that workforce, because of either being infected or being furloughed, is significantly under the pump, and the ability to look at to fill all the rostering is really problematic, especially for the smaller independent ones, the smaller single facility operators. They're reliant on agency staff, which is just not there. And the number of aged care workers that are just not able to turn up to a shift is really putting a stress on the system. We need surge workforce. We need to look at all options outside of the state, bring them in and have that as a coordinated resource, coordinated essentially by the federal government in concert with the state government and the public health unit, so that there's transparency and we can allocate staff. But also, why do we keep persisting that if a facility has one COVID case, and there, as we call an index case, and that facility waves the flag and says, we're not equipped to deal with this, we'd like to transfer, we need to provide a solution. I'm calling it a subacute facility where we have that between the hospital and the aged care facility, where we can put all COVID patients together under trained.
Yeah, it makes perfect sense. It makes perfect sense, Tony Bartone. I'll reach out to the Federal Minister for Aged Care and see if I can't get him on to discuss all of this. But I agree with you, that interim measure, getting them out of the nursing home before they infect other residents, is critically important. Thank you very much for your time.
My pleasure. Thanks for having me on.